In moments of heightened stress, whether due to an impending deadline, a sudden confrontation, or an unexpected challenge, the human body undergoes a remarkable transformation. Blood pressure, often a quiet metric of overall health, can spike dramatically, leaving even the healthiest individuals wondering about the root cause of these transient changes. Known as stress-induced hypertension, this phenomenon is a physiological response that underscores the complex relationship between the mind and body. While often temporary, these blood pressure surges provide critical insights into how the body adapts to perceived threats. Stress, whether physical or psychological, initiates a cascade of reactions in the body, collectively referred to as the fight-or-flight response. This is a survival mechanism deeply ingrained in human biology, which equips the body to confront or escape potential danger. At the heart of this response lies the activation of the sympathetic nervous system, a division of the autonomic nervous system responsible for regulating involuntary bodily functions. When stress is perceived, signals from the brain activate the sympathetic nervous system, prompting the adrenal glands to release adrenaline and noradrenaline into the bloodstream. These stress hormones act swiftly, orchestrating a series of physiological changes to prepare the body for action. Heart rate accelerates, ensuring an increased supply of oxygen-rich blood reaches vital muscles. Blood vessels constrict, particularly smaller arteries, a process known as vasoconstriction, which raises vascular resistance and subsequently elevates blood pressure. Simultaneously, blood flow is redistributed away from non-essential systems, such as digestion, toward the brain, heart, and skeletal muscles. This redirection prioritizes functions critical for survival, enhancing alertness and physical performance. These changes, while beneficial in short bursts, come at the cost of heightened blood pressure, even in individuals with otherwise normal readings. One of the defining characteristics of stress-induced hypertension is its transient nature. In most cases, once the stressor subsides, the parasympathetic nervous system, often referred to as the rest and digest system, counterbalances the sympathetic response. This restores the body to a state of equilibrium, bringing heart rate and blood pressure back to baseline levels. However, the impact of stress on blood pressure is not uniform across individuals. Factors such as baseline cardiovascular health, genetic predisposition, and the frequency or intensity of stress events play significant roles. For those with pre-existing hypertension, stress-induced spikes may exacerbate an already delicate condition, while individuals with a lower baseline blood pressure may experience only modest increases. While the fight-or-flight response is typically associated with physical threats, modern stressors are often psychological in nature. Financial concerns, interpersonal conflicts, or performance anxieties can evoke the same physiological reactions as a life-threatening situation. The body, unable to differentiate between these stress types, reacts uniformly, releasing stress hormones and triggering a rise in blood pressure. Interestingly, the perception of stress, rather than its objective severity, determines the intensity of the response. A situation perceived as manageable may elicit only a mild reaction, whereas one viewed as overwhelming can provoke a pronounced spike in blood pressure. This underscores the subjective nature of stress and highlights the importance of psychological resilience in mitigating its effects. While occasional stress-induced blood pressure increases are typically harmless, chronic stress paints a different picture. Prolonged activation of the sympathetic nervous system can lead to sustained elevations in blood pressure, contributing to the development of chronic hypertension. This condition, often dubbed the silent killer, is a major risk factor for cardiovascular diseases, including heart attacks and strokes. The physiological toll of chronic stress extends beyond the cardiovascular system. Persistent exposure to stress hormones can lead to inflammation, insulin resistance, and impaired immune function, creating a fertile ground for a host of health issues. Moreover, the emotional strain associated with chronic stress can compound its physical effects, fostering a cycle of health deterioration. Not everyone experiences stress-induced hypertension in the same way. Biological and psychological factors, including age, gender, and stress coping mechanisms, influence the magnitude of the response. For instance, individuals with heightened sensitivity to stress, whether due to genetic predispositions or learned behaviors, may exhibit exaggerated blood pressure spikes. Baseline blood pressure also plays a pivotal role. Those with higher resting blood pressure levels may experience more pronounced increases during stress, amplifying their overall cardiovascular risk. Conversely, individuals with robust stress management practices may exhibit resilience, with milder or shorter-lived responses. Understanding the mechanisms behind stress-induced hypertension is only the first step. Mitigating its effects requires a multifaceted approach that addresses both the physiological and psychological dimensions of stress. Relaxation techniques are among the most effective strategies for counteracting the fight-or-flight response. Deep breathing exercises, for instance, stimulate the parasympathetic nervous system, helping to lower heart rate and blood pressure. Meditation and mindfulness practices, which emphasize present-moment awareness, can also reduce the perceived intensity of stressors, dampening the overall response. Physical activity serves as both a preventive and corrective measure. Regular exercise enhances cardiovascular resilience, improving the body's ability to handle stress-induced spikes. Activities like yoga and tai chi, which combine physical movement with relaxation, are particularly effective for managing stress. Dietary modifications can further support blood pressure regulation. Reducing sodium intake, increasing potassium-rich foods, and consuming heart-healthy fats help maintain vascular health. Limiting caffeine and alcohol, which can exacerbate stress responses, is also beneficial. Beyond lifestyle changes, addressing the psychological underpinnings of stress is essential. Cognitive behavioral therapy, for example, can help individuals reframe stressors, reducing their emotional and physiological impact. Building a robust support network and cultivating healthy coping mechanisms, such as hobbies or social activities, further enhances stress resilience. Stress-induced hypertension highlights the profound interconnectedness of the mind and body. It serves as a reminder that health is not merely the absence of disease, but a state of dynamic balance influenced by physical, emotional, and environmental factors. Recognizing and addressing the impact of stress on blood pressure is an integral part of maintaining overall health and well-being. Moreover, understanding this phenomenon sheds light on the broader implications of stress in modern life. As the pace of life accelerates and stressors become more diverse, the ability to manage stress effectively is emerging as a critical skill. Investing in stress management not only mitigates immediate health risks, but also fosters long-term resilience, enabling individuals to navigate life's challenges with greater ease. Stress-induced hypertension, while often fleeting, serves as a window into the body's intricate stress response system. Through the coordinated actions of the sympathetic nervous system, stress hormones, and vascular adjustments, the body adapts to perceived threats, ensuring survival in the short term. However, the implications of this response extend far beyond momentary blood pressure spikes. By exploring the physiological, psychological, and individual dimensions of stress-induced hypertension, we gain valuable insights into the delicate balance that underpins health. Armed with this understanding, individuals and healthcare providers can work together to address the root causes of stress, paving the way for a healthier, more resilient society. In a world where stress is an inevitable part of life, learning to navigate its effects is not just a necessity. It is a cornerstone of modern health and wellness. Thank you for tuning in. If you found this deep dive into stress-induced hypertension insightful, be sure to hit that like button and subscribe for more content like this. Stress affects us all, but understanding how it impacts our health is the first step toward managing it better. Remember to take care of yourself, both mentally and physically. Until next time, stay healthy and see you in the next video.